Hey guys, this is Dr. Lera here at Heron Lakes Animal Hospital. Today we're here with Sasha. Sasha is a 13-year-old female spayed Persian, and so she came in because she was stopped eating almost everything after potentially a stressful event. And so what ended up happening was she had two stressful events back to back, and she ended up developing a lot of nasal discharge, and that's very common if a cat has something called an upper respiratory infection. Most commonly, herpes is going to be the condition that's going to cause that in cats. And so one of the main questions that clients will usually ask is it something that I can get? The answer is no. Typically, most viruses are species specific, which means cat stuff stays with cats, dog stuff stays with dogs. Okay, very rarely will you have something like the bird flu, which will jump from one species to the other. Okay, so what ended up happening was Sasha really didn't eat very much for about 4 or 5 days, and so that makes me very, very scared of her developing something called hepatic lipidosis, which is fatty for a fatty liver. And if she does develop that, although it may not be fatal, it is something that will require intensive hospitalization and treatment and that kind of stuff. So what we did, if you come over here and you take a look at her tube, you'll see that she has this tube sticking out the side of her neck. And so this is what's called an esophagostomy tube. This particular tube goes in through the side of her neck while she's under anesthesia and goes into her esophagus, which is her food piping, and that sits right above the opening for her stomach. Doesn't go into her stomach, but just above it. And so what ends up happening is we're able to go ahead and give Sasha food through this tube without her really getting stressed out, because when she had this upper respiratory infection, she had a lot of nasal discharge coming out. She didn't really feel like eating very much. And so she would actually start open mouth breathing, which is very uncommon for cats. So what will end up happening is we go ahead, we place this tube, we're able to give her medications, we're able to give her food with minimal stress necessary, and we can help her recover. So we placed this tube, not this past Friday, but the Friday before that, almost 10 days ago today, and she's been doing great. The rule of thumb is they need to eat on their own well for 3 days before the tube typically comes out. We're on day 4 now, and she did great through the weekend, and so we're gonna be removing the tube right now. So one thing that we're gonna do first is we'll go ahead and get ready to scrub the area where the tubing is at. We'll grab some chlorhexidine scrub, squeeze this out, and then what we're going to do is we're going to go ahead and remove this bandage. This bandage that we place here was a bandage that is just there just to kind of protect the opening from where the tube sits. Mom and Dad like to call, initially they were calling Sasha Scuba Steve because she looked like a character from a movie, and then when she started sneezing they called her Scuba Sneeze. So we're going ahead and removing this bandage now. Let's see here. Alright, and one of the things that's really important when this bandage is being placed, it is very loose. It is not something that you want on very tight. So we're going to come over here, we're going to remove this. So this little piece of what we call Telfa pad is there in place to go ahead, and we put like a triple antibiotic on there. And so that just goes ahead, we change that bandage on a daily basis, and that's to help reduce any sort of chances of infection. So now we're going to come in here, I'm going to scrub this a little bit, I'm going to soften things up, and then we'll come in and we will remove the sutures that are holding it in place. So let's see here. So we'll come right here. You can see these are special scissors that have a little hook on the end of them, and that's so it catches the stitches. Okay, make sure that we are completely out, and there we go. So that's the tube that was in there. You can see we even cut off the end of this particular tube just to make sure that the opening is wide so the food is less likely to get caught in there. So we're going to go ahead and scrub this up a little bit more. Okay. All right. So you can see there's just some stuff that's crusting, and there's actually some suture material left. We're gonna go ahead and grab that after we finish scrubbing, just to kind of get all this stuff off. We want to do this to reduce the chances of any sort of infection. Okay, we'll go ahead, we'll use these hemostats. These are tweezers, just to pull out that suture. We're gonna go ahead, scrub just a little bit more. I can tell you that Sasha is really excited to have this tube out. Okay, and you can see over here she's got a little bit of irritation from where the suture was going through her skin, right here, here, and here. And so now that we've scrubbed that up, we're gonna go ahead, get our Telfa pad. We're gonna cut this to a smaller size. We're gonna put our triple antibiotic on here. And it's not necessary that it goes inside, it's just more to go on top. So we'll just place it right here. We're gonna place a very small bandage around her neck. Come here, kiddo. And Sasha is actually behaving very, very well. Okay. This is called cast padding. Cast padding rips very easily. We want that on purpose, because if you put too much pressure on it, then it could actually almost suffocate her or choke her a little bit. What we did with this particular pink wrap is we actually pre-unrolled it and then re-rolled it so it comes off very, very easily, so there is no pressure on there. So we're gonna come back in about 3 days. We'll go ahead, we'll check the opening and make sure that it's all healed up, and most likely after that, she'll be done and she'll be ready to roll. Thanks for watching, guys. If you found this helpful, please subscribe, share with others, and give us a thumbs up. Have a great day.